No. Okay. Welcome, everybody. We are back on appropriations, hearing another section of the governor's proposed biennial budget. And my name is Kathy Breen. I'm Senate Chair of Appropriations, and appropriations folks introduced themselves earlier today in a work session. So I am going to invite Senator Sanborn to lead us in introducing the Committee on Health Coverage, Insurance, and Financial Services.
Thank you, Senator Breen. I should have a list in front of me and I don't. So bear with me while I find all of the boxes. We'll start with Representative Arford.
Yes, thank you, Madam Chairs. And I am Representative Poppy Arford, and I represent District 49, western part of Brunswick.
Representative Matheson.
Good afternoon, everybody. My name is Christy Matheson. I represent District 1 in Kittery, Maine.
Representative Brooks.
Good afternoon. My name is Heidi Brooks. I represent House District 61, which is part of Lewiston.
Representative Blyer.
Thank you, Madam Chair. I'm Mark Blyer, represent District 22, which is Leamington and part of Buxton, Standish, and Limerick.
Representative
Senator Sanborn, would it be helpful
Yes.
if your members raise their hands?
No, that's all right. I think I've got them now.
Okay.
All right, and we're only on one page. I was worried that we were on 2 pages, but I think I've got them. Thank you.
Thanks.
Representative Evans.
Thank you, Madam Chairs. I am Richard Evans. I represent House District 120, Dover, Foxcroft, Atkinson, Brownville, Medford, Milo, Lakeview Plantation, and Orneville Township. Thank you.
Representative Melrano.
Good afternoon, everyone. My name is Gina Melrano. I represent House District 62, which is part of Auburn.
Representative Morris.
Good afternoon. I am Representative Joshua Morris. I represent Turner, Leeds, and part of Livermore.
Representative Tepler, and you can tell me if I missed any of our other members.
I think you've got everyone who happens to be present now, Madam Chair. And I am Denise Tepler. I serve as House Co-Chair of the committee, and I represent House District number 54, which is all of the town of Topsom.
And my name is Heather Sanborn. I represent Senate District 28, which is half of Westbrook and half of Portland, although I am very pleased to be coming to you from Carrabassett Valley this afternoon. And I serve as the Senate co-chair of HCIFS, and we're glad to be here with our AFA colleagues.
Madam Chair, Senator Brenner has joined us.
Oh, wonderful. Senator Brenner, please introduce yourself.
Good afternoon. I'm Stacy Brenner, and I represent Senate District 30, which includes all of Gorham, most of Scarborough, and part of Buxton.
And Senator Stewart.
Oh, good.
Good afternoon. I'm Trey Stewart. I represent Senate District 2, which includes 51 communities in Southern Aroostook and Northern Penobscot counties, including the town of, what are we going to go with today? Let's see. Did I say Patton already? I think I said Patton already, but Patton.
Well, welcome everybody. And if you're on HCIFS and we did not get the chance to have you introduce yourself, please raise your hand and we'll be sure to do that. We're going to be joined shortly by the administration to introduce their part of the bill. And just as a housekeeping issue, thank you for changing your names to your title and your committee. I appreciate that. And then also, while we're meeting, if you need my attention, please use the raise hand function. And if somehow that doesn't work for you, you can always just shout out Madam Chair, and we will be sure to stop and take care of whatever question or technological challenge you're having as we go along. So we have been at this now. This is appropriations third week on biennial public hearings, but that doesn't mean we're perfect. I'm sure we will have some glitches along the way, and we thank everybody for their patience and good humor as we go along in this new Zoom universe. So any questions from any committee members, either HCIFS or PROPS, before we begin? All right. I want to welcome Commissioner Figueroa. Commissioner, the floor is yours.
Good afternoon. Thank you.
Good afternoon.
Good afternoon, Senator Breen, Representative Peirce, and members of the Joint Standing Committee on Appropriations and Financial Affairs, Senator Sanborn, Representative Tepler, and members of the Joint Standing Committee on Health Coverage, Insurance, and Financial Services. My name is Kirsten Figueroa, and I am the Commissioner of the Department of Administrative and Financial Services. I am here today to testify in support of the fiscal year 22-23 biennial budget bill LD 221, specifically those items on today's agenda relating to DAFs. As Governor Mills said, at a time when Maine people are hurting, when small businesses are struggling to keep their doors open, when the ranks of the unemployed have swelled, and when we are fighting a deadly virus all around us, we are proposing balanced budgets as required by the Constitution that continue efficiencies, good fiscal management, and curtailments to cover projected revenue shortfalls for all 3 fiscal years. They focus on combating the COVID-19 pandemic by continuing to rebuild the state's public health infrastructure and protecting essential healthcare, education, and life-saving services. They do not change Maine tax rates, and they maintain the Budget Stabilization Fund. With a future made unpredictable due to the ongoing pandemic, these budgets make good on the promise of government, which is to protect and support the well-being of our people and institutions. The Department of Administrative and Financial Services, or DAFS, consists of 10 bureaus, a handful of boards and commissions, and more than 1,200 employees serving the public and all 3 branches of state government. The department has a broad range of responsibilities. We serve as the principal fiscal advisor to Governor Mills, prepare the state budget, coordinate the financial planning and programming activities of state agencies, prepare the financial records of the state, and advise the Maine legislature on the economic status of the state and financial statutes of state government. Additionally, DAFS oversees all aspects of human resources, including employee benefits, contract negotiations, recruiting, retaining, training, and performance, information technology services, including cybersecurity, data management, application development, project management, technology infrastructure, accessibility and network services, maintenance, repairs, and capital improvements of state-owned buildings and grounds, lease space, procurement, contracting, and vendor management, state postal services, surplus property, tax collection, tax law and tax policy, and fleet management. Various internal services for state agencies are provided by the department, including review of accounting transactions and procedures and the implementation of account controls. We also administer the state's lottery operations, medical and adult use marijuana programs, and the sale of distilled spirits within Maine's borders. Today's session is about the health insurance component, and I will begin on page A-3, the Accident, Sickness, Health Insurance Program. This program funds the management and administration of the state employee health plan, dental plan, direct reimbursement accounts, deferred compensation, vision care, retired teacher health premium reimbursement, management of contracted services for the employee assistance programs, and the development of health and safety policies and programs to reduce the incidence of illnesses and injuries to employees. I will begin with the baseline in this account. The general fund baseline budget is just over $800,000 in each year, including personal services for a part-time position. The program also includes allocation for 2 separate internal service funds, the Accident, Sickness, Health Insurance Internal Service Fund and the Firefighters and Law Enforcement Health Insurance Program Fund. You will notice that there is a significant jump in the all other baseline budgets for these two funds. This is the result of erroneously including costs of goods sold in this category. Title V, Section 1666 specifies that cost of goods sold expenditures in internal service funds are not subject to legislative allocation. Cost of goods sold accounts capture the costs associated with activities in these programs that are subsequently billed to and paid for by other entities. The legislative allocation to pay for those expenses is in the agencies that will get billed. In other words, the payments to health insurance carriers made from this account are included in the payroll expenses of every employee. Including an allocation for COGS account would mean the legislature is allocating for those same expenses twice. The baseline all other allocation for accident, sickness, health insurance internal service fund is overstated by 167.4 million in each year. The correct figure should be $1,591,383 in each year. The baseline all other allocation for the firefighters and law enforcement health insurance fund is overstated by approximately 1.7 million each year. The correct figure is $51,707. We apologize for the error, and we will make these corrections in the biennial change package. There is one initiative in this program. The initiative establishes one public service coordinator, one position to support the additional workload associated with two pieces of legislation passed by the previous legislature. This is a combined allocation of $88,671 in fiscal year 22 and a combined allocation of $98,817 in fiscal year 23. This position is needed to keep up with the demands of more ancillary groups joining the state's health plan. Public Law 2019, Chapter 424, an act to expand health insurance options for town academies, allowed 11 municipalities into the state's health plan effective January 2020. Public Law 2019, Chapter 446, an act to enhance the retired county and municipal law enforcement officers and municipal firefighters health insurance program, made several changes to the retired county and municipal law enforcement officers and municipal firefighters health insurance program, including increasing the state subsidy of premiums from 45 to 55%, allowing eligible employees more time to enroll in the program, and allowing certain enrollees to join the state's health plan. 200 to 250 municipalities are eligible to participate, and currently there have been 618 active plan participants and 60 municipalities participating thus far as a result of the legislation. The Trade Adjustment Assistance Health Insurance Program is on page A36. This program provides a group health insurance product for individuals certified to receive federal assistance for health coverage under the terms of the tax credit program within the Federal Trade Adjustment Assistance Reform Act of 2002. Individuals certified under the Trade Adjustment Assistance Reform Act are workers who have been displaced because of foreign competition. Although there have not been any expenses in this program since 2010, this is still an active program that could have participants. There are no proposed changes to this program. And this concludes my testimony. Thank you. I'm happy to take any questions.
Thank you, Commissioner Figueroa. Are there any questions from any committee members for the commissioner? If you would use your raised hand function, that would make it easy for me to see you. We are on now 2 screens. I am not seeing any. So I think we will move on. We have one moment. Let me make sure I say this correctly. We have Karen Lee Harrington here. to testify on our next two sections. Ms. Harrington, are you with us?
Good afternoon.
There she is. Welcome.
Thank you. Do you have a preference with which agency we start with?
I do not. I mean, I have your testimony, so I was assuming you would go along with that, but it's up to you.
I'll start with the Maine Health Data Organization, if that is all right. Okay.
Thank you.
Just give me a minute to pull it up.
Yep, no problem.
Okay, so good afternoon, Senator Breen and Senator Sanborn, Representative Pierce and Tepler, and members of the Joint Standing Committee on Appropriations and Financial Affairs and Health Coverage, Insurance and Financial Services. My name is Karen Lee Harrington. I'm the director of the Maine Health Data Organization, and I'm here today to present testimony in support of those items presented in the governor's proposed biennial budget for the Maine Health Data Organization. The MHDO, I'll refer to it as the MHDO going forward, was established as an independent executive agency in 1996 because of the recommendations of the Hospital Deregulation Task Force that the Maine Healthcare Finance Commission be abolished, but that its data collection functions be retained, expanded, and ultimately transformed into what is now the Maine Health Data Organization. The MHDO is governed by a multi-stakeholder board of directors that are appointed by the governor and represent consumers, employers, payers, providers, hospitals, and government. The purpose of the MHDO defined in statute is to create and maintain a useful, objective, reliable, and comprehensive health information database that is accessed by a broad group of authorized data users to improve healthcare costs, quality, and access for Maine people, to promote the transparency of the cost and quality of the most costly and utilized healthcare services in the state. And we do that in conjunction with the Maine Public Forum through a publicly accessible website, which is Compare Maine. We're responsible for developing annual public reports that include comparison reports of the top 15 most common inpatient and outpatient hospital and non-hospital procedures in the state, the 10 most common services provided by physicians in the office, and the 25 most frequently prescribed and most costly drugs in the state. We're also required to support other state agencies and legislative mandates regarding healthcare data as required. The Maine Health Data Organization collects all kinds of data to maintain this comprehensive health data set. And I won't read through all of this, but this is just to give you a sense. We collect claims data. It comes in from more than 40 commercial payers, and then we collect data from the public payers, MaineCare and Medicare. We collect hospital data for every single hospital encounter that happens in this state, both inpatient, outpatient. It includes the emergency department, and it also includes data from all of the physician practices that are owned by hospitals. We collect data from hospitals and nursing homes around quality measures, specifically looking at healthcare associated infections. And with the passage of a new law a couple of years ago, we will be collecting, beginning next year, rates for surgical site infection for knee and hip replacement surgeries. And we'll also be collecting C. diff rates for nursing homes. We put that on hold due to the pandemic, but when things settle down, we will move forward with collecting that data. With passage of some new legislation a year or so ago, we're collecting pharmaceutical pricing component data. We're one of the first in the country to collect data not only from manufacturers, but from wholesale distributors and pharmacy benefit managers. And this helps us understand what are the components that go into the pricing of prescription drugs from the very beginning of the process. We collect data from hospitals in terms of their financial status, their hospital audited financial statements, and they're also required to complete a standardized financial template that includes information around profitability, and you'll see some other key common financial ratios. We collect organizational data that identifies physicians and practices affiliated with hospitals and how the hierarchy is structured within these organizations, and that information is reviewed and submitted annually. We hold over 1 billion records of data, and that number grows each year. And actually, it grows every month with the addition of new data. The Maine Health Data Organization is not funded by the state's general fund, but rather it derives its revenue from two sources as described in statute: an annual assessment on healthcare providers, payers, pharmaceutical manufacturers, wholesale distributors, and pharmacy benefit managers. And then the second source is user fees from authorized MHDO data users accessing our data pursuant to the criteria defined in our rule that governs the release of data to the public. The amount of the MHDO annual assessment is contingent on the budget you approve, minus any unallocated funds remaining from the prior fiscal year. The governor's proposed budget for MHDO is on page A-211 of your budget document. And as mentioned earlier in my testimony, there are no general funds for the Maine Health Data Organization. The proposed budget contains no initiatives for fiscal year 22 through 23. However, consistent with the fiscal year 2021 biennial budget, we are requesting continued authorization to transfer available balances and personnel services up to a specified amount to our all other category by financial order. This specific language can be found on page 28, Part DD of the General Fund Bill language. That concludes my testimony on the items for the Maine Health Data Organization, and I'm happy to answer any questions.
Thank you, Ms. Harrington. Any questions for Ms. Harrington from any committee members? Not seeing any.
Okay, so now I'll switch over to the Maine Quality Forum.
Sounds good.
Okay. So again, good afternoon. My name is Karen Lee Harrington. I'm the director of the Maine Quality Forum, and I'm here to present testimony in support of those items presented in the governor's proposed biennial budget for the Maine Quality Forum. The Maine Quality Forum was established in 2003 pursuant to Title 24A, Chapter 87, Section 6951, to monitor and improve the quality of healthcare in the state of Maine. The duties of the Maine Quality Forum as defined in statute include promoting the transparency of healthcare quality and performance measurement, data coordination, annual public reporting, including the total spending on primary care services in the state of Maine, consumer education, and healthcare infection prevention activities. You'll see bulleted on the next page or so are some key deliverables that the Maine Quality Forum is responsible for. And just quickly, again, defining reporting requirements for the collection of hospital and other healthcare sectors, health quality measures, and we do that via Rule Chapter 270, which is the Uniform Reporting System for Healthcare Quality Data Sets. That is a major substantive rule, so it does come back to you all. We support and develop strategies in collaboration with the Maine Health Data Organization for the public reporting and transparency of healthcare costs and quality measures on Compare Maine. We partner with the Maine CDC on supporting the Healthcare Associated Infections / Antibiotic Resistance Collaborating Partners Committee. I co-chair that committee with the individual who runs the HAI part of the Maine CDC. And that group is focused on reducing the rate of healthcare associated infections in Maine. We support the external validation of the reporting of healthcare associated infections in Maine hospitals. We have an outside vendor who does that work on our behalf. We are responsible for developing the annual report to the legislature on the amount of primary care spending in the state using the MHDO claims data. We develop the annual report to the legislature on the state of healthcare associated infections in our hospitals in Maine. And we support the development and ongoing maintenance of our Infection Prevention Forum, which is a web-based remote training platform for Maine healthcare facilities. And the topics that are currently in that platform are topics around COVID-19 exposure investigation. We'll be adding a whole bunch more around COVID-19, personal protective equipment training, core infection prevention, biological hazards, and bloodborne pathogens for both clinical and non-clinical staff. And through a grant that the Maine CDC received for Project First Line, the Maine Quality Forum is providing technical support to the Maine CDC to really enhance this website that we've created, the Infection Prevention Forum website, to enhance it by bringing in more training modules around COVID-19 and other infection prevention control, and by expanding it to other types of healthcare entities. So we're really excited about that partnership and the work we're doing on their behalf. And then we're responsible for supporting in partnership with the MHDO, the development of a data reporting infrastructure that allows authorized data users to generate information about the quality and cost of healthcare in the state of Maine at both an aggregate and granular level. The governor's proposed budget for MQF is on page A-134 of your budget document, and the budget contains no initiatives for fiscal year 22 and fiscal year 23. And that concludes my testimony on items for the Maine Quality Forum. And I'm happy to answer any questions that you might have.
Thank you, Ms. Harrington. Any questions for Ms. Harrington? I'm not seeing any.
Okay, thank you.
Thank you for being with us. Appreciate it. So now we're going to move on to the Department of Professional and Financial Regulation. I see Commissioner Head has joined us. Welcome, Commissioner Head. The floor is yours. Commissioner, we need you to unmute. Sorry.
Thank you.
You should probably start at the beginning.
Yes, I will. Good afternoon, Senator Breen, Representative Peirce, and members of the Joint Standing Committee on Appropriations and Financial Affairs, Senator Sanborn, Representative Tepler, and members of the Joint Standing Committee on Health Coverage, Insurance, and Financial Services. My name is Ann Head. I am the Commissioner of the Department of Professional and Financial Regulation. I'm here today to testify in support of the Biennial Budget Bill LD 221. I'm pleased to present information to both committees regarding the Governor's biennial budget request for this department for 9 programs: the Bureau of Insurance, Bureau of Financial Institutions. I'm here today to testify in support of the Office of Securities, Board of Insurance, Board of Licensure in Medicine, Board of Nursing, Board of Optometry, Board of Dental Practice, and the Board of Osteopathic Licensure. It's important to note that our budget contains no general fund appropriations or initiatives. The department is funded exclusively with dedicated revenue and relies on other special revenue funds as the sole source of revenue to fund department operations. So in this setting, we are asking for permission to spend the funds that we have. I have in this portion given you the budget pages so that it may be easier to follow this. The first agency is the Bureau of Consumer Credit Protection. This bureau encourages healthy competition among creditors while protecting Maine citizens from unfair and deceptive financial practices. The agency administers the Maine Consumer Credit Code, the Fair Credit Reporting Act, and the Fair Debt Collection Practices Act, and other consumer financial protection laws. The Bureau also administers the state's foreclosure prevention program and most recently has taken the role of student loan ombudsman. The program is funded with other special revenue funds, primarily from licensing and volume fees. Funding for foreclosure prevention comes primarily from the real estate transfer tax on deeds of foreclosure or in lieu of foreclosure. The agency is led by Superintendent Will Lund. The baseline budget request for this program continues funding for the protection of consumers through regulation and oversight of various financial service providers, and funding for staff and contracts with housing counselors for the foreclosure prevention program. This program has 3 initiatives related to a reorganization of the Bureau. Over the past few years, as the Bureau's responsibilities and number of regulated entities have continued to increase, the Bureau has carefully evaluated their duties and resources to develop a plan to address their growth while continuing to provide efficient and effective regulation. The new responsibilities include oversight and licensing of several new programs, including student loan servicers, tax lien foreclosures, employee leasing companies, money transmitters, payroll processors, and guaranteed asset protection waivers, policy oversight. Over the last 10 years, the Bureau has seen an increase in the number of licensees from 6,588 to 12,911, increasing the number of entities requiring examination from 3,500 to 7,000. Consumer complaint numbers remain high and have increased in complexity throughout the past decade. Written consumer credit complaints received in 2019 totaled 435, and an additional 379 foreclosure-related requests for assistance were received through the Bureau's foreclosure hotline. The Bureau's goal is to establish distinct divisions within the Bureau to address the increasing number of licensees and additional Bureau responsibilities, while continuing to respond efficiently to consumer complaints and requests for assistance, and ensuring that licensing and regulation of supervised entities are sufficient to identify and rectify potential problem areas before they become issues for Maine consumers. Toward the end of 2019, the Bureau finalized a reorganization plan to be considered in the 2022-2023 budget submission. The proposed reorganization would divide the Bureau into 4 functional units: administration, examination, licensing, and consumer complaint and outreach, and includes establishing new examiner positions and creating a deputy superintendent position. Establishing divisions within the Bureau will create a more equitable division of duties and clearly outline responsibilities of existing and new staff to enable the Bureau to more efficiently and effectively manage its workload. Realizing the need to address the increasing workload, but considering the state's current fiscal climate, I worked with the Bureau and the administration to develop a limited proposal to address immediate needs, phasing in over the next 2 years the establishment of 4 new examiner positions and a deputy superintendent to assist with the management of administrative functions, including budget, legislation, personnel issues, and general oversight of the office. The Bureau currently has 5 examiners and 1 principal examiner responsible for the examination of approximately 7,000 entities, some of which require financial examinations as frequently as every 18 months. Adding 2 examiners to the division will enable the Bureau to shorten the timeline between examinations and, for entities requiring examination on a specified basis, complete the examinations within required timeframes. The Bureau currently licenses and registers over 12,000 entities and individuals. In addition to the 12,000 annual renewals, the Bureau must review license surrenders, new license applications, and address other licensing issues and questions that may arise. Adding 2 licensing examiners and separating the licensing duties from consumer complaint and outreach responsibilities would decrease the time needed to process license requests, review and respond to complaints, and allow for a more complete review of all applications, complaints, and general inquiries. The reorganization would be funded with fee increases. Maine has comparatively low fees for licensing and registration, some of which have not been changed since 1975. The proposed fee increases would still leave Maine at or below average or median levels compared to other states for such fees. Overall, these 3 initiatives would increase headcount by 3 in fiscal 22 and another 2 in fiscal 23, and provide other special revenue funds, personal services, and all other allocation totaling $300 in fiscal 22 and $494,933 in fiscal 23. The Board of Dental Practice on page A423 is the first of 5 affiliated boards I'll present today. The term affiliated indicates that these licensing boards have a statutory connection to the department. Each board has its own staff and develops its own budget under the general oversight of the department. The Board of Dental Practice protects the health and safety of Maine citizens through regulation of the practice of dentistry. The board is supported solely by other special revenue funds generated from licensing fees. The board has 9 members appointed by the governor and employs an executive director and administrative staff. The board elects a chair from its members. Dr. Mark Zakowski is the current board chair. The baseline budget request for this program continues funding for administrative operations, including staff, complaint investigation, board member travel and compensation, and funding to participate in the Medical Professionals Health Program. The program has a single initiative, reducing other special revenue funds, all other allocation by $9,798 in fiscal 22 and $7,220 in fiscal 23, reflecting a decrease in the cost of services provided by the Office of the Attorney General. Projected costs are based on estimates provided by the AG's office. Turning now to page 425, A425 is the Bureau of Financial Institutions. The Bureau supervises state-chartered financial institutions, including banks, credit unions, and non-depository trust companies. The Bureau maintains and promotes safe and sound financial practices, strength, stability, and efficiency of financial institutions, security of deposit and share funds, reasonable and orderly competition, and development and expansion of financial services advantageous to the public welfare. The Bureau is divided into 2 functional units: examination and research and administration. The program is funded by other special revenue funds, primarily from assessments and examinations. BFI is led by Superintendent Lloyd LaFountain. The baseline budget request for this program provides funding for continued regulation and oversight of financial institutions. There are no new initiatives. Next, we come to the Bureau of Insurance on A426. The Bureau of Insurance is responsible for the regulation and oversight of the insurance industry in Maine. The primary responsibility of the Bureau is to regulate insurance companies and insurance professionals in the public interest. Duties and responsibilities include the examination of domestic insurers and limited oversight of foreign and alien insurers, the approval of all policies and contract forms used by insurers in the state, and the authorization of individual and group workers' compensation self-insurers. The Bureau ensures that all licensed companies are financially solvent and that all licensed entities and individuals comply with Maine law. The program is funded with other special revenue funds, primarily from licensing fees. The Bureau is led by Superintendent Eric Chapa. The baseline budget request for the Bureau of Insurance provides funding for the continued regulation and oversight of the insurance industry through licensing, registration, examination, complaint investigation, outreach, and education. The program has 2 initiatives. The first increases other special revenue fund all other allocation by $509,330 each fiscal year for actuarial support, examination services, and rate reviews. The complexity of these services has increased, and although an attempt was made to increase allocation in the fiscal year 2021 budget to a level that would be sufficient, the Bureau has needed to continue to supplement its budget by allotting additional funds by financial order. This request should give the Bureau adequate resources to address the substantial increase in the need for specialized skill sets available only through outside contracts, including cybersecurity, actuarial expertise, econometrics, and complex investment analysis. The second initiative impacts 6 programs within the department, requesting increases to other special revenue funds, all other allocation, to cover stay cap expenses due to increases in the rates billed to the department. Estimated costs are based on the current stay cap rates. For the Bureau of Insurance, this initiative increases allocation by $123,007 in fiscal 22 and $126,206 in fiscal 23. Turning now to the Board of Licensure in Medicine on page A428. The Board of Licensure in Medicine safeguards the lives and health of Maine citizens by licensing qualified applicants and regulation of the medical practice of those licensees. The board is supported solely by other special revenue funds generated from licensing fees. The board consists of 11 members appointed by the governor and employs an executive director and administrative staff. Dr. Louisa Barnhart is the current board chair. The baseline budget request for this program continues funding for administrative operations such as staff, complaint investigation, board member travel and compensation, and contracting with the Medical Professional Health Program. It has 2 initiatives. The first is establishing a full-time equivalent count and providing other special revenue funds, personal services, and all other allocation, totaling $1,286 each fiscal year for 1 additional board member. Public Law 2019, Chapter 627, increased the number of board members, but it did not establish the full-time equivalent or provide allocation. The second initiative increases allocation by $41,136 in fiscal 22 and $52,449 in fiscal 23 to cover the increased cost of services provided by the Office of the Attorney General. Projected costs are based on estimates provided by the AG's staff. Moving now to the Board of Nursing on page A430. This is the budget request for the Maine State Board of Nursing. The board protects the public through the regulation of nursing practice. It is supported solely by other special revenue funds generated from licensing fees. The board consists of 9 members appointed by the governor and employs an executive director and administrative staff. Valerie Fuller is the current board chair. The baseline budget request for this program continues funding for administrative operations such as staff, complaint investigation, board member travel and compensation, and contracting with the Maine Professional Health Program. The board has 2 initiatives. The first is requesting other special revenue funds, personal services, and all other allocation, totaling $124,546 allocation in fiscal 22 and $45,163 in fiscal 23. To fund the approved reclassification of the Director, Board of Nursing position. This reclassification is effective April 2nd, 2019, and includes 2 retro payments in fiscal 2022. The second initiative is providing $9,627 allocation in fiscal 22 and $9,915 in fiscal 23 for increased stay cap expenses. The Office of Securities is the next program on pages A431 and 432. The office protects Maine investors through the administration and enforcement of the Maine Uniform Securities Act. It reviews applications to register securities for sale in Maine and filings for exemption from registration, licenses broker-dealers, agents, investment advisors, and investment advisor representatives doing business in Maine, conducts on-site examinations of operations of licensees, administers an investor education program, responds to consumer complaints, investigations, and when warranted by the circumstances, issues cease and desist and other administrative orders. The office enforces the state commodity code and the regulations of the sale of business opportunities. The program is funded by other special revenue funds from license renewal fees and has a small federal expenditures fund allocation. The office is led by Securities Administrator Judith Shaw. The baseline budget request for this program provides funding to continue to protect Maine citizens against fraud and other abusive practices in connection with the sale of securities through licensing, registration, and investigation, as well as outreach and education. This program has 8 initiatives, each requesting increases to other special revenue funds, all other allocation.
Excuse me, Commissioner Head?
Yes.
I apologize for interrupting. Representative Tepler has her hand up. Representative Tepler, do you have a question?
Yes, Madam Chair, thank you. I do have a question, and I'm going back to the Board of Nursing, if you don't mind, Commissioner Head.
If we, Representative Tepler, I should have probably made this announcement. I apologize. We're going to let the commissioner go through everything and then circle back and do questions. I should have said that. I apologize.
No problem. I'll just write my question down so I don't forget.
Thank you. Thank you, Commissioner Head. Please proceed.
The first initiative on A431 increases the allocation by $51,133 annually in the Office of Securities Investor Education account for outreach activities promoting cybersecurity awareness and fraud prevention and to raise financial awareness. The next initiative increases allocation by $2,250 annually for technology services to cover the increased costs of cell phone service and portal fees for online licensing. Examiners are provided cell phones to facilitate teleworking and communication while in travel status. The third initiative provides additional funding for anticipated costs of witness travel related to criminal cases. The office has several cases pending, and increased allocation will cover travel for preparation and judicial proceedings. This initiative increases allocation by $13,294 in fiscal 22 and $35,794 in fiscal 23. The fourth initiative at the bottom of A431 increases allocation by $23,959 in fiscal 22 and $36,230 in fiscal 23 to cover the increased cost of services provided by the Office of the Attorney General based on projections and estimates provided by the office. The next initiative at the top of page A432 is requesting $15,340,000 additional allocation annually for increased rent expense. This increase is the result of a redistribution and recalculation of space for each program in the building and does not reflect an increase in the overall cost to the department. The next initiative is requesting an additional $13,049 allocation annually in increased general operating costs, including database subscriptions used for investigations and examinations, National Association of Professional dues, and credit card fees for online licensing. The seventh initiative is requesting an additional $5,113 allocation annually for travel for examinations. In-state travel is expected to increase as the number of licensed firms that the office is charged with examining has increased. The final initiative at the bottom of page 432 provides for $25,465 allocation in fiscal 22 and $25,877 in fiscal 23 for increased stay cap expenses. The Board of Optometry. The next program on A433 is the Board of Optometry. It protects the public through the regulation of the practice of optometry, including examination and licensing of qualified applicants and investigation of complaints and cases of non-compliance. The board is funded exclusively with other special revenue funds, primarily licensing fees. The board consists of 6 members appointed by the governor for terms of 5 years and employs a single administrative employee. The board elects a president from its members. Thomas Netto is the current board president. The baseline budget request for this program continues funding for administrative operations such as staff, complaint investigation, board member travel and compensation, printing, and rulemaking. It has 3 initiatives. The first increases allocation by $4,736 in fiscal 22 and $5,166 in fiscal 23 to cover the increased cost of services provided by the Office of the Attorney General as projected. Projected costs are based on estimates. The next initiative is requesting $592 additional allocation annually for increased rent expense. As with the Office of Securities, this increase is the result of a redistribution and recalculation of space for each program and does not reflect an increase in the overall cost to the department. The final initiative for the Board of Optometry is providing $1,743 allocation in fiscal 22 and $1,780 in fiscal 23 for increased stay cap costs. And finally, on page A434 is the Board of Osteopathic Licensure, which protects the public through the regulation of osteopathic medicine. The board is funded exclusively with other special revenue funds from licensing fees. The board consists of 11 members appointed by the governor and employs a single administrative employee. The board elects a chair from its members. Dr. Scott Thomas is the current board chair. The baseline budget request continues funding for administrative operations such as staff, complaint investigation, board member travel and compensation, and contracting with the Maine Medical Professionals Health Program. The program has a single initiative increasing allocation by $2,601 in fiscal 22 and $7,283 in fiscal 23 to cover the increased costs of cost of legal services provided by the Office of the Attorney General. This concludes my testimony in support of the governor's biennial budget request for this portion of the department, and I thank you for your time. I'd be happy to answer questions.
I think Representative Peirce is going to take over for just a few minutes. Thank you.
Thank you, Madam Chair. I see Senator Sanborn has a question and then a few others.
Thank you, Madam Chair. And thank you, Commissioner Head, for that presentation. And at the risk of belaboring things, I'm going to ask a question about pages, I think, of the budget that weren't part of your presentation. So the HCIFS committee has jurisdiction over all health licensing, and some of that is contained within your licensing function rather than in one of the affiliated licensing boards. And so whether you want to talk about this today or for our work session, I really would like some more information about the report that we heard yesterday or this morning from Maine Public with regard to the licensing of mental health professionals and the delays that those folks are experiencing as they come out of school in getting their full licensure when they're qualified for it in the midst of this pandemic and the mental health crisis that is resulting from it. So that wasn't part of your presentation today, so certainly don't need you to respond today if you want to prepare for the work session, but would love to get your response to it and your feedback on it.
Thank you, Senator, for the question. And I'd like to actually do both. I'd like to give you some information right now. And obviously, I will need to come back for the work session with additional thoughts and information. So to give other members in the room a bit of background, we have 4 mental health licensing boards within the department. They are the Board of Counseling Professionals, the Board of Social Worker Licensure, Alcohol and Drug Counselors, and the Board of Examiners in Psychology. Those 4 boards are assigned to one work group that has 5 members currently. And what I would like to talk about is what may be happening in this group of licensees and applicants that may be different from what occurs in non-pandemic years. So the first thing that happened that increased the number of applications was the governor's executive order that provided for temporary emergency licenses for out-of-state licensed practitioners in the mental health area and other healthcare licensee pools to apply for a temporary license without charge that would allow those folks licensed in another state to use telemedicine, telehealth, if you will, to treat patients that live in Maine. That provision that allowed for temporary licenses bloomed instantly. And over time, although we seem to be well into the pandemic period, we still receive hundreds of applications for those temporary licenses. It sort of sounds like a reduced license that doesn't require as much review of an application as a standard license, but that actually is not the case. It does take time to review each of those temporary license applications to make sure that they satisfy the criteria that was in the executive order. So far, the staff has issued 1,600 of those, and they have 130 more waiting for their review. So that was in a year that was unexpected. That was not expected, and it did put pressure on the staff to prioritize those, as I thought the governor would want under these circumstances. So that was a decision that I made. That probably took some time away from our regular applicants who may have been coming out of a graduate program or an undergraduate program. And at the same time, those people needed to take exams to move to a higher license category. And of course, the pandemic reduced the number of seats available for those exams. Now, the agency doesn't administer those exams. A national exam organization offers those exams to people who have applied for exams and then use a national organization to take the exam and get the score. So the fewer exams seats available, I'm sure frustrated people trying to get in to take an exam during this period. So, you know, that was it was just something that happened to all of our professions when COVID shut down the examination process for safety reasons. They have now started to open up, and there are more seats available. So we hope that that sorts itself out, but we're not there yet. And the third thing I wanted to mention was the complexity of the applications for these 4 mental health programs. It's quite complicated. The application requires many different types of documentation to be submitted with the application, and all of this is done online. Our online traffic has also increased, and the complexity of the applications themselves is pretty high. I could, it's a balancing act. We want all of the applications to be reviewed carefully so that everybody is on an even playing field. So ordinarily, we would like to see social work and psychology applications turned around between 4 and 6 weeks. Counseling applications take longer because there are different ways for an applicant to come into the licensing field, the counseling field, I'm sorry. So that takes additional review, and I would rather have the applications carefully reviewed and assist my staff in whatever they need to keep going and continue to review with care. So this is just sort of the outlines of what I see today. No one wants an applicant to wait any longer than is absolutely necessary. And I take the letter from the folks who signed off on it very seriously. I'm going to work with my staff to come back to you all with, some more information on what's exactly happening. But these are the factors that I think makes this area or this time frame very challenging. And on the other hand, the balancing act is we know mental health services are greatly needed in this period where it may be easier to use telehealth to reach patients, but there are many more patients that need those services. So we're going to work hard to make sure that those applications are carefully reviewed, and I'll come back with more information at the work session or at a special session for the HCIFS committee.
Thank you. Madam Chair, can I have a quick follow-up?
Absolutely.
So I guess my only other question there, as we're in the context of the budget, and the reason I thought it was appropriate to bring this topic up today, is that it strikes me as you have identified as being a staffing issue, as being an issue where 5 people are insufficient to do the work of licensing all 4 of those types of professions because of the complexity and because of the volume. And so I would really encourage you to think about whether you should be asking for additional allocations and to let us know where your OSR stands right now with regard to those licensing boards, so that we can determine whether there is funding, already available that just needs to be allocated, or whether potentially that funding that should be there has been swept in prior years, and we really need to rectify that situation. So I really love to get more detail on that from a financial perspective as we work through this issue over the next few days and report back to the AFA. Thank you.
And I appreciate that. I appreciate your thoughts on that. At this point in time, having just started looking into, it's not that I just started, it's been on my mind as I see the ebb and flow of applications in different areas. I wouldn't want to make any hard and fast comment on additional staff until I get a lot deeper into the reasons why. It takes upwards of 2 to 3 years for a staff member assigned to these boards to have an understanding and really a capacity to do this kind of work. It is complicated. It's unlike other areas of licensing that we deal with in the office. So I appreciate your comments, and I will come back with additional information. Thank you.
Next, I have Representative Tepler and then Representative Arata.
Thank you very much, Madam Chair. And thank you, Commissioner, for being here. I certainly want to put an exclamation point on what Senator Sanborn said. It is something that was startling to hear this morning and of concern. My other question is about the director of the Board of Nursing and the director's reclassification. I just am curious whether or not the position of director of an affiliated board provides an equivalent salary across the board. So is the director of nursing with this reclassification on an equivalent level to the director of the Board of Medicine?
Thank you for that question. The executive director for the Board of Licensure in Medicine is a statutory position in, I believe, the first or second title of Maiden revised statutes. So that's set in statute, and it is higher than the other executive directors that are in the other affiliated boards. This particular reclassification started about 2 years ago. The chair of the board, with the full support of the board, thought that the compensation should be increased. Went through the whole process with our HR partners to do all of the documentation for that. Unfortunately, it wasn't addressed in the supplemental that was right in front of it at that point. So it's because it was approved by HR, which was fine. The retro payments seemed very large, but it was approved 2 years ago, and it was effective 2 years ago, even though the change in allocation was not in the budget. But there is a difference. Board of Medicine has a higher statutory compensation than the other affiliated boards.
Follow up, Madam Chair?
Yes, please.
Thank you. I thank you very much, Commissioner. I very much, for the purposes of our work session, love to see if it's possible without interfering with personnel, if it's a public amount, what the comparative salaries of the different board chairs are.
The board chairs or the executive directors?
I'm sorry, the executive directors, not the board chairs. I'm sorry.
I'll get whatever is public.
Thank you very much.
All set, Representative Tepler?
Yes.
Thank you. Representative Arata.
Thank you, Madam Chair, and thank you, Commissioner Head, for your report. I was wondering if for the work session, if you could provide a list or sort of a spreadsheet of the entities and individuals or the type of entity and individual licensure that will require a fee increase. So maybe what the fee is now and what you propose the fee to be in this budget.
You're on mute, Ms. Head.
Great. Are you, Representative, are you referring to the Bureau of Consumer Credit Protection and
yes.
its new positions? Yes, right. I can do.
Yes, thank you very much.
Thank you. Are there any other questions? Are there any questions for any other parts of the testimony that we've heard today? Representative Arata, do you have another question? I'm sorry. No, okay. I'm not seeing any questions by any of our committee members. We do not have anyone here to give public testimony for this part of the budget. So I'll turn to my good co-chair and then also to Maureen Dawson in our office to make sure we haven't missed anything.
Thank you, Chairperson. I appreciate it. I think this is probably the end of our work together, but like you, I always like to check with our analyst and make sure we've met all of our responsibilities before we sign off. And of course, for appropriations folks, we'll be back at 3 o'clock to meet with our colleagues on veterans and legal affairs. So I'm not hearing anything from our analysts. So I want to thank the members of Health Coverage, Insurance, and Financial Services for joining us today. And we look forward to your report back. Senator Sanborn, anything you want to mention?
Yeah, Senator Breen, thank you. If I could just ask the HCIFS committee to reassemble at 2:30. We'll take a 15-minute break and then reassemble for our work sessions on our Zoom at 2:30. Thank you.
Good to see you
Thank you
all.
very much for joining us. Appropriations members, you can sign out and sign back in, or you can go on mute and hide your camera, turn off your camera. That's entirely up to you. Good afternoon, folks. I want to welcome our friends from Veterans and Legal Affairs. And before we formally start, I would ask that folks from VLA go on to your Hollywood Square and rename yourself so that we know your title and your committee. And to rename yourself, you hover over the box and you have 3 dots. And you click on the 3 dots and you'll go to a drag down menu that says, and you'll have a rename option, and then you can type in your title and your 3-letter committee. So we are live and streaming on YouTube and on audio. So I want to welcome everybody to the joint public hearing with Appropriations and with the Veterans and Legal Affairs Committee. And Appropriations folks introduced themselves earlier today, but we would love to take a minute and introduce the Veterans and Legal Affairs colleagues we have with us. Senator Lucchini, would you like to do that, or shall I have folks raise their hand? It's up to you.
Thank you, Madam Chair. Maybe we'll do the hand raising since I'm not sure how many we have here. But good afternoon. I'm Louis Lucchini. I represent most of Hancock County in the Senate. And did you want me to go through the committee members or?
Sure, go
Okay.
right ahead. Thank you.
Sure. House Chairman Chiazzo.
Thank you, Senator Lucchini. I'm Chris Chiazzo. I represent House District 28, which is beautiful West Scarborough, Maine.
Representative Tuttle.
Representative John Tuttle, District 18, part of Sanford, mostly Sanford's east side.
Great. Senator Farron.
Hey, good afternoon, folks. I'm Brad Farron, representing Senate District 3, which is the majority of Somerset County in the town of Rome and Kennebec County.
Representative McCray.
Hi, everybody. I'm Jay McCray, representing Harpswell, West Bath, and Northeast Brunswick in the House.
Representative Riley.
Hi, I'm Representative Riley. I represent House District 34, which is part of Westbrook.
Okay, Representative Supika.
Hi, I'm Representative Supika, Laura Supika, and I represent District 126 in Bangor.
Okay, we've got Representative Corey doubling for us. And,
good afternoon. I'm Patrick Coy, represent House District 25, which is part of Wyndham.
And we have our analyst, Janet Stocco, looks like. And our clerk, Karen Montel. Great.
Well, Mr. Chair, that means that Representative Corey gets 2 votes, right, Patrick?
Thank you, Senator Lucchini, and welcome to VLA. We are going to invite the administration on momentarily to give their testimony. Before we start, I just want to kind of remind folks that the purpose of the day here is to gather information and clarify information from the bill sponsor, the administration. If there's information you need and don't get today, our analysts will be in touch with each other and will provide the requested information for your work session. So feel free to ask for information either today or for the work session. And if you have a question, typically what we've been doing is, well, you know what, we actually don't have any members of the public testifying. So we probably could go through each section, and after each section, take questions, because we don't have any members of the public who are waiting to testify. So we'll go through DAFs first, and then Defense, Veterans, and Emergency Management, and then Ethics, and then Secretary of State, and we'll stop for questions as we go along, so that those folks can take questions and go on with their day. If there's something that comes up during the course of the testimony where you can't hear something, if you need help with your technology or anything, please don't hesitate to either raise your hand at the bottom, electronically, or don't hesitate to just shout out Madam Chair, and we'll stop what we're doing and do our best to solve any problems that are in front of us. So this is our third week doing public testimony, but we still make the occasional mistake. So I hope folks will bear with us and be patient. And my co-chair, Representative Peirce, and I are very assertive about putting people on mute when they're not actually speaking, so that we can avoid any unintended commentary going out across the cyber universe. So before we begin, are there any questions for me or my co-chair before we start our public hearing? All right, not seeing any. So thank you very much. We will welcome the DAFS commissioner. We just haven't seen her lately. So we're going to welcome back Commissioner Figueroa. I hope she's here.
Good afternoon.
There she is. Welcome back.
Thank you. Happy to be here. Good afternoon, Senator Breen, Representative Peirce, and members of the Joint Standing Committee on Appropriations and Financial Affairs, Senator Lucchini, Representative Chiazzo, and members of the Joint Standing Committee on Veterans and Legal Affairs. My name is Kirsten Figueroa, and I am the Commissioner of the Department of Administrative and Financial Services. I am here today to testify in support of the fiscal year 22-23 biennial budget bill, LD 221, specifically those items on today's agenda relating to the Department of Administrative and Financial Services. As Governor Mills said, at a time when Maine people are hurting, when small businesses are struggling to keep their doors open, when the ranks of the unemployed have swelled, and when we are fighting a deadly virus all around us, we are proposing balanced budgets as required by the Constitution that continue efficiencies, good fiscal management, and curtailments to cover projected revenue shortfalls for all 3 fiscal years. They focus on combating the COVID-19 pandemic by continuing to rebuild the state's public health infrastructure and protecting essential health care, education, and life-saving services. They do not change Maine tax rates, and they maintain the Budget Stabilization Fund. With a future made unpredictable due to the ongoing pandemic, these budgets make good on the promise of government, which is to protect and support the well-being of our people and institutions. The Department of Administrative and Financial Services, or DAFS, consists of 10 bureaus, a handful of boards and commissions, and more than 1,200 employees serving the public and all 3 branches of state government. The department has a broad range of responsibilities. We serve as the principal fiscal advisor to Governor Mills, prepare the state budget, coordinate the financial planning and programming activities of state agencies, prepare the financial records of the state, and advise the Maine legislature on the economic status of the state and the financial statutes of state government. Additionally, DAFS oversees all aspects of human resources, including employee benefits, contract negotiations, recruiting, retaining, training, and performance, information technology services, including cybersecurity, data management, application development, project management, technology infrastructure, accessibility and network services, maintenance, repairs, and capital improvements of state-owned buildings and grounds, leased space, procurement, contracting and vendor management, state postal services, surplus property, tax collection, tax law and tax policy, and fleet management. Various internal services for state agencies are provided by the department, including review of accounting transactions and procedures and the implementation of account controls. We also administer the state's lottery operations, medical and adult use marijuana programs, and the sale of distilled spirits within Maine's borders. We will begin on page A8 with the baseline budget for the Alcoholic Beverages General Operations Program. The Bureau effectively regulates the alcoholic beverage industry in Maine by ensuring responsible business practices by agency liquor stores, beer and wine wholesalers, and bars and restaurants within a favorable economic climate. Through the guidance of the State Liquor and Lottery Commission, the Bureau has responsibility for the pricing, listing, and delisting of spirits. The Bureau is tasked with managing a profitable business organization with profits deposited into the Liquor Revenue Fund that in part pays the Maine Municipal Bond Bank for debt service related to the $220.6 million hospital payment revenue bond. The general fund baseline supports 13 positions in the Division of Liquor Licensing and Enforcement. The division reviews applications for liquor licenses and periodically inspects each location. In addition, the division collects excise taxes on beer, wine, and flavored malt beverages. A fee on the registration of labels of alcoholic beverages is deposited into the other special revenue account. These funds are used for education and awareness programs for alcohol servers. This program also includes the Alcoholic Beverages Fund with an additional 2 positions. You will notice that there is a significant jump in the all other baseline budget for this fund. This is a result of erroneously including costs of goods sold in this category. Pursuant to Title V, Section 1666, costs of goods sold and expenditures in enterprise funds are not subject to legislative allocation. The baseline all other allocation for Alcoholic Beverage Fund is overstated by approximately $135.8 million in each year. The annual allocation should be approximately $12.1 million each year. We apologize for this and will make the correction in the biennial budget change package. There are 5 new initiatives in this program. The first initiative reduces the general fund appropriations by $159,833 in each fiscal year based on projected expenditures for information technology and consulting services. This is a continuation of savings identified in the FY21 curtailment process. The second initiative realigns the funding of one Public Service Manager 3 position to be 100% within the Alcoholic Beverages General Operations Alcoholic Beverages Fund. This position is currently split 50-50 between the Alcoholic Beverages Fund and the Lottery Administration Program within the State Lottery Fund. This initiative will align work effort with appropriate funding for the Deputy Director for Liquor Operations within the Bureau of Alcoholic Beverages and Lottery Operations. This initiative will also be found on page A22 in the Lottery Administration Program. The final initiative on page 8 provides the funding to reorganize 5 liquor licensing inspector positions to more appropriately align with their duties. This request, approved by the Bureau of Human Resources, is funded with a deappropriation in all other. At the top of page A9, there is an initiative to reorganize one Public Service Manager 1 position to a Public Service Manager 2 position and uses all other funds for this reorganization. This and the previous initiative will provide a more balanced liquor inspection division structure to better serve the licensee community and the state. The final initiative in this program reflects the allocation increase necessary for the acquisition, licensing, installation, implementation, maintenance, debt service, and support of a system to modernize alcoholic beverages operations within the Bureau. This upgrade would allow, as examples, for better reporting, improved communications and outreach with licensees, and transforming the excise tax collections from paper to electronic. Part of the funding would be through a certificate of participation, which is included in Part L on page 17 of the language document. On page A-6 is the Adult Use Marijuana Public Health and Safety Fund. This program pays the expenses of public health, safety awareness, education, and enhanced law enforcement training programs supporting the adult use of marijuana. The other special revenue is from certain marijuana excise tax and sales tax, as described in Public Law 2017, Chapter 409, Subchapter 11. There are no new initiatives in this program. On page A-7 is the baseline for the Adult Use Marijuana Regulatory Coordination Fund. This program supports the implementation, administration, and enforcement of the adult use of marijuana. This program includes 32 positions in the general fund and 3 positions within the other special revenue fund, funded from licensing and application fees. The positions consist of senior leadership, a compliance division to ensure compliance within the program, a licensing division, and a data analytics division, which oversees the state's inventory tracking system and uses data to better understand the impact of marijuana on our state. There are 2 initiatives in this program. The first initiative proposes to eliminate 5 positions in the office and reorganizes the director to identify it as a major policy influencing position similar to the other directors in DAFs. The language associated with this change can be found in Part U, beginning on page 22 of the language document. The positions for the Office of Marijuana Policy were established in Public Law 2017, Chapter 409, Subchapter 11. The 5 positions identified here were never utilized and will not be needed in the new organizational structure. This initiative results in a general fund savings of $469,721 in FY22 and $485,439 in FY23. The second initiative increases the allocation in the Adult Use Marijuana Regulatory Coordination Fund Other Special Revenue account to align with the projected resources. The newness of this account had us believing an allocation adjustment was necessary when we put the budget together, but additional information indicates that this is no longer required. We will remove this request in the biennial change package. The last DAF's program scheduled for today is lottery operations on page A22. The Maine State Lottery offers instant ticket scratch games and draw games to the public, generating over $64 million last year to the general fund. The operations of this program are supported entirely by the proceeds from the sale of lottery tickets. The budget allocation supports the administration of the state's lottery games, including 22 positions responsible for customer service, marketing, field sales, security, and general operations. There are 3 initiatives in this program. The first initiative is the transfer of the Public Service Manager 3 position discussed in the Alcoholic Beverages General Operations, found on page 2 of my testimony and page A8 of the budget document. The second initiative reorganizes one marketing specialist position to a lottery marketing manager and funds the reorganization with all other. The marketing specialist has evolved to require greater focus on marketing efforts and consumer communications planning. This initiative will increase the responsibilities of the incumbent and allow the Deputy Director for Lottery Operations to dedicate more time to strategic modeling and long-term planning. The final initiative in this program provides funding for the proposed reorganization of one Office Assistant 2 position to an Accounting Associate 1 position and reduces all other to fund the reorganization. The Maine State Lottery has 2 positions that perform the same duties. The positions are responsible for assisting the public entering our Augusta office to claim prizes. Currently, one is an Accounting Associate 1 position, which is a salary grade 11, and one is an Office Assistant 2 position, salary grade 8. This initiative will align the titles and salary grades appropriately with their functions to provide parity for the positions. And now we turn to language parts. On page 16 of the language document, Part J transfers $1 million in each year of the biennium from the medical use of marijuana fund to the unappropriated surplus of the general fund. This is a one-time transfer, as we do anticipate increased expenses in this account, including our licensing system, the InforMe online portal, and implementing the state's inventory tracking system. Beginning on page 22 of the language document, Part U amends Title II and Title V to include the Director of the Office of Marijuana Policy. When the Office of Marijuana Policy was created, with some positions being transferred from the Department of Health and Human Services, the Director was not added to these statutes. This part will identify the Director, Office of Marijuana Policy, as a major policy influencing position within the Department of Administrative and Financial Services and adds it to the list of positions with salaries set by the governor. This concludes my testimony. Thank you. I would be happy to address any questions.
Thank you, Commissioner.
Thank you.
Looks like we have a question from Representative Corey.
Great, thank you. Thank you for being here, Commissioner. So I sat on the marijuana committee that went and wrote that law a few years back in 2017, as did Representative Peirce. I'm sure she's got a special interest in this as well, especially with regard to the amount of money that goes into the public health and safety portion of that. I've got kind of a much broader question. So there's certain costs that were involved in setting up the Office of Marijuana Policy and getting the market off the ground. And I know that we're still not even there with getting the market off the ground, which is understandable due to COVID. I think I'd heard somebody testify on that last week. And the other thing I know is that with the medical program right now, we're able to show how much money is coming from that program into MRS and domain revenue based on the sales of marijuana. Do we have any of these numbers for adult use yet? How much money is actually coming into the program, number one? And then number two, do we know when we're going to hit our break-even point? Like, I know that, you know, when we were looking at this and we were looking at the fiscal notes as we were passing these public laws, you know, there was a certain, you know, point where, you know, rather than, you know, being in the hole, we were making money. Just how much in the hole are we right now, and when do we expect to be, you know, dug out of that hole and actually making revenue, you know, based on the sale of adult use marijuana?
So I'd be happy to bring that to you for the work session. I might want to just define what by whole, do you mean the fact that the office is currently funded by general funds and you're wondering like when will the sale of marijuana kind of offset what the cost of the office is?
Sure, that's what I think. And the cost of regulation, everything. I know that there's, you know, some stuff with regard to the cost of regulation that's tied up in the licensing fees and all of that other stuff. But I know that, you know, it was going to, the market had to be, you know, so big before it was going to, you know, produce the amount of money we needed to pay for, if we want to call it an investment that Maine has made in a regulatory system. I'm curious as to, you know, when we expect that to happen. People talk about marijuana money, all the time, and, all the things that they want to spend marijuana money on. But I've always said, at this point, there just is no marijuana money. We've spent a lot of money in order to get up to a point where we would actually be able to have an adult use, marketplace. So my question, I guess, more or less is, when is there going to be marijuana money?
Okay, well, I do know some monies have already transferred because we have open businesses. I don't have those numbers right handy, but I will get them to you for the work session.
But also, how much have we spent to set this up or get this off the ground?
Gotcha.
Thank you.
You're welcome.
Any other questions for Commissioner Figueroa? I am not seeing any. So at this time, we will transition over to Major General Farnham, who I believe is here. Welcome back.
Thank you.
Nice to see you again. We are looking forward to your testimony.
Okay, outstanding. Good afternoon, Senator Breen, Representative Peirce, and members of the Joint Standing Committee on Appropriations and Financial Affairs, Senator Lucchini and Representative Queso, and members of the Joint Standing Committee on Veterans and Legal Affairs. My name is Doug Farnham, and I'm the Commissioner of the Department of Defense, Veterans and Emergency Management. I'm here today to testify in support of the biennial budget LD 221. As Governor Mills said, at a time when Maine people are hurting, when small businesses are struggling to keep the doors open, when the ranks of the unemployed have swelled, and when we are fighting a deadly virus all around us, we are proposing balanced budgets as required by the Constitution that continue efficiencies, good fiscal management, and curtailments to cover projected revenue shortfalls for all 3 fiscal years. They focus on combating the COVID-19 pandemic by continuing to rebuild the state's public health infrastructure and protecting essential healthcare, education, and life-saving services. They do not change Maine tax rates, and they maintain the Budget Stabilization Fund. With a future made of unpredictable due to the ongoing pandemic, these budgets make good on the promise of government, which is to protect and support the well-being of our people and institutions. The Department of Defense, Veterans and Emergency Management coordinates and administers the discharge of Maine state government's responsibility for all military, veteran, and emergency management activities through the authorization, planning, provision of resources, administration, operation, and audit of each. In addition to their federal mission, our soldiers and airmen are immediately available to respond to the governor and citizens of Maine in times of crisis, man-made or natural disasters. The Maine Bureau of Veteran Services provides numerous support services to Maine's 115,000 veterans and manages Maine's 4 veterans memorial cemeteries across the state. Although not included in my testimony today, the Maine Emergency Management Agency is charged with all disaster mitigation, preparedness, response, recovery, and homeland security operations within the state of Maine. I will address our budget in the order listed in the public hearing testimony agenda and will include programs with and without budget initiatives. I will begin on page A116, the Department of Defense, Veterans and Emergency Management Administration Program. The program primarily includes appropriations from the general fund. The administration program consists of the commissioner, deputy commissioner, and staff who administer all programs of the department. The program funds the personal services and all other, which includes travel, insurance, general operations, and technology. There are only 2 initiatives associated with the program, both on page A116. Initiative number 1 reallocates the cost of 1 Public Service Coordinator 1 position funded at 100% general fund in the administration program to 10% general fund in the administration program and 90% federal expenditures fund in the military training and operations program. This initiative will also be found on page A124, initiative number 3, which reflects the partial transfer to the military training and operations program. The general fund decreases by $108,687 in FY22 and $109,479 in FY23. Funding is provided to the state of Maine for operations and maintenance of National Guard facilities through a master cooperative agreement. This initiative reallocates the cost of one Public Service Coordinator 1 who provides professional services to support the MCA. This cost share proposal is allowable in accordance with the terms of the agreement. Initiative number 2 provides one-time funding for environmental closure activity costs at the former Maine Military Authority site in Limestone, Maine. General fund increases in FY22 by $400,000. This provides one-time funding for studies and activities required in accordance with the terms of the former Maine Military Authority's hazardous waste generator license. This is phase 1 of the project, which will determine if additional phases are needed. Since pages A118 through A20 cover the Maine Emergency Management Agency programs, which I talked about yesterday, I will now move on to page A121 for the Maine National Guard Post-Secondary Fund. The Maine National Guard Post-Secondary Fund provides funding for 100% tuition reimbursement at any state post-secondary education institution for qualified members of the Maine National Guard. This is primarily a non-lapsing general fund all other, which provides tuition funding for qualified members of the Maine National Guard at any state post-secondary education institution, as well as at any qualifying private nonprofit in state post-secondary education institution. There are no new initiatives for this program. I will now proceed to pages A122 through A128 for military training and operations. Military Training and Operations program has 2 components, the Army National Guard and the Air National Guard, and each perform dual missions. A state mission as a resource to the state to provide trained and disciplined forces for domestic emergencies or needs such as helping communities deal with floods, tornadoes, hurricanes, snowstorms, and most recently COVID-19 pandemic, and a federal mission as a resource to the President for prompt mobilization for war or emergencies in support of our national security. The state budget properly funds the Master Cooperative Agreement between the National Guard Bureau and the state of Maine. It is for both the Army and Air National Guard facilities and environmental support. It is also for the support of more than 3,100 soldiers, airmen, civilian employees, and the sustainment of more than 2 million square feet of state guard facilities and more than 365,000 acres of training land. There are 28 initiatives to adjust the baseline for the program. Out of the 28 initiatives, there are 26 personal services actions. 17 of those reallocate different positions, resulting in a net decrease in the general fund by $312,166 in FY22 and $318,707 in FY23. On the other hand, federal expenditures will have a net increase by $307,669 in FY22 and $313,542 in FY23. Funding is provided to the state of Maine for the operation and maintenance of National Guard facilities through the Master Cooperative Agreement. The Maine Army National Guard audited the federal state cost share for the facilities and programs associated with the MCA, and in accordance with National Guard Regulation 420-10, Chapter 7. As a result of this audit and with the concurrence of the United States Property and Fiscal Office, the funding for these positions is reallocated accordingly. The 17 reallocation initiatives are found on the following pages. Page A122, initiative number 1, reallocates the cost of one maintenance mechanic position from 50% general fund and 50% federal expenditures fund to 27% general fund and 73% federal expenditures fund within the same program. General fund decreases by $15,061 in 22 and $15,674 in FY23. Federal expenditure fund increases by the same amounts in FY22 and 23 respectively. Page A123, initiative number 1 reallocates the cost of one inventory and property associate 2 position from 100% federal expenditures fund to 73% federal expenditures fund and 27% general fund within the same program. General fund increases by $19,425 in FY22 and $19,590 in FY23. Federal expenditures fund decreases by the same amount in FY22 and 23 respectively. Page A124, initiative number 3, reallocates the cost of one Public Service Coordinator 1 position funded 100% general fund and administration Defense Veterans Emergency Management Program to 10% general fund in the administration Defense Veterans Emergency Management Program and 90% in Federal Expenditures Fund in the Military Training and Operations Program. Federal Expenditures Fund increases by 108,687 in FY22 and 109,479 in FY23. The corresponding decrease in general fund was reported in the Administration DVM program. Initiative number 4 reallocates the cost of one buyer two position from 80% Federal Expenditures Fund and 20% General Fund to 100% Federal Expenditures Fund within the same program. General Fund decreases by 15,792 in FY22 and 16,450 in FY23. Federal Expenditures Fund increases by the same amounts in FY22 and 23 respectively. Initiative number 5 reallocates the cost of one maintenance mechanical supervisor position from 100% General Fund to 27% General Fund and 73% Federal Expenditures Fund within the same program. General Fund decreases by 64,805 in FY22 and 67,274 in FY23. Federal Expenditures Fund increases by the same amounts in FY22 and 23 respectively. Page A125. Initiative number 2 reallocates the cost of one facilities project manager position from 75% Federal Expenditures Fund and 25% General Fund to 100% Federal Expenditures Fund within the same program. General Fund decreases by 28,345 in FY22 and 28,495 in FY23. Federal Expenditures Fund increases by the same amounts in FY22 and 23 respectively. Initiative number 3 reallocates the cost of one vacant contract grant specialist position from 80% Federal Expenditures Fund and 20% General Fund to 100% Federal Expenditures Fund within the same program. General Fund decreases by 17,817 in FY22 and 17,968 in FY23. Federal Expenditures Fund increases by the same amounts in FY22 and 23 respectively. Initiative number 5 reallocates the cost of one superintendent of buildings position from 20% General Fund and 80% Federal Expenditures Fund to 27% General Fund and 73% Federal Expenditures Fund within the same program. General Fund increases by 9,293 in FY22 and 9,386 in FY23. Federal Expenditures Fund decreases by the same amounts in FY22 and 23 respectively. Page A126. Initiative number 1 reallocates the cost of one warehouse superintendent position from 100% Federal Expenditures Fund to 73% Federal Expenditures Fund and 27% General Fund within the same program. General Fund increases by 17,704 in FY22 and 18,420 in FY23. Federal Expenditures Fund decreases by the same amount in FY22 and 23 respectively. Initiative number 2 reallocates the cost of one Director of Building Control Operations position from 60% General Fund and 40% Federal Expenditures Fund to 27% General Fund and 73% Federal Expenditures Fund within the same program. General Fund decreases by 29,908 in FY22 and 31,062 in FY23. Federal Expenditures Fund increases by the same amounts in FY22 and 23 respectively. Initiative number 3 reallocates the cost of one building mechanical systems specialist position from 100% General Fund to 27% General Fund and 73% Federal Expenditures Fund within the same program. General Fund decreases by 60,583 in FY22 and 62,514 in FY23. Federal Expenditures Fund increases by the same amounts in FY22 and 23 respectively. Initiative number 4 reallocates the cost of one vacant building maintenance coordinator position from 75% Federal Expenditures Fund and 25% General Fund to 47% Federal Expenditures Fund and 53% General Fund within the same program. General Fund increases by 21,311 in FY22 and 22,367 in FY23. Federal Expenditures Fund decreases by the same amounts in FY22 and 23 respectively. Page A127. Initiative number 2 reallocates the cost of one Office Specialist 1 from 80% Federal Expenditures Fund and 20% General Fund to 100% Federal Expenditures Fund within the same program. General Fund decreases by 15,176 in FY22 and 15,316 in FY23. Federal Expenditures Fund increases by the same amounts in FY 22-23 respectively. Initiative number 4 reallocates the cost of one auto mechanic 2 position from 100% general fund to 27% general fund and 73% federal expenditures fund within the same program. General fund decreases by $56,592 in FY 22 and $57,322 in FY 23. Federal expenditures fund increases by the same amounts in FY 22 and 23 respectively. Page A128, initiative number 1 reallocates the cost of one carpenter position from 100% general fund to 27% general fund and 73% federal expenditures fund within the same program. General fund decreases by $52,734 in FY 22 and $53,464 in FY 23. Federal expenditures fund increases by the same amounts in FY 22 and 23 respectively. Initiative number 2 reallocates the cost of one maintenance mechanic position from 100% general fund to 27% general fund and 73% federal expenditures fund within the same program. General fund decreases by $42,286 in FY 22 and $42,274 in FY 23. Federal expenditures fund increases by the same amounts in FY 22 and 23 respectively. I will now move on to the second category of personal services actions, reclassification, reorganizations, and range changes. There are 8 initiatives in this category that will decrease general fund by $72,115 in FY 22 and $71,686 in FY 23. On the other hand, the federal expenditures fund will increase by $186,627 in FY 22 and $197,891 in FY 23. The 8 reclassification, reorganization, range changes initiatives are found on the following pages. Page A123. Initiative number 3 provides funding for the approved reorganization of one vacant civil engineer 3 position to facilities project manager position to reflect the change of duties and responsibilities. Federal expenditures fund decreases by $6,706 in FY 22 and $6,923 in FY 23. Initiative number 4 provides funding for proposed reorganization of one vacant engineering technician 3 position to a planning and research associate 1 position to reflect the change of duties and responsibilities within the same program. Federal expenditures fund increases by $4,901 in FY 22 and $5,175 in FY 23. Initiative number 5 provides funding for the proposed reorganization of one engineering technician 4 position to a facilities project manager position to reflect the change of duties and responsibilities within the same program. Federal expenditures fund increases by $8,074 in FY 22 and $12,378 in FY 23. And initiative number 6 provides funding for the proposed reclassification of one senior planner position to a public service coordinator 1 position to reflect the change of duties and responsibilities within the same program. Federal expenditures fund increases by $11,976 in FY 22 and $15,674 in FY 23. Page A124, initiative number 6 provides funding for the approved range change of 6 military firefighter supervisor positions from range 17 to range 19 and 3 assistant military fire chief positions from range 19 to range 21. Federal expenditures fund increases by $74,490 in FY 22 and $74,489 in FY 23. I should note that this initiative carries forward an initiative from the governor's FY 21 supplemental budget proposal to fund the back pay and increase the federal expenditures fund necessary to pay military firefighter supervisors and assistant military fire chiefs. This was an employee-initiated reclassification. Page A125, initiative number 4, provides funding for the approved reorganization of one high-voltage electrician position to a high-voltage electrician supervisor position and reallocates the cost from 100% general fund to 27% general fund and 73% federal expenditures fund to reflect the changes in duties and responsibilities within the same program. General fund decreases by $58,800 in FY 22 and $58,377 in FY 23. Federal expenditures fund increases by $70,952 in FY 22 and $73,740 in FY 23. Page A127, initiative number 1 provides funding for the approved reorganization of one vacant locksmith position to an electronic security system technician position and reallocates the cost from 75% federal expenditures fund and 25% general fund to 73% federal expenditures fund and 27% general fund within the same program. General fund increases by $2,667 in FY22 and $2,814 in FY23. Federal expenditures fund increases by $2,235 in FY22 and $2,415 in FY23. Initiative number 3 provides funding for the approved reorganization of one Office Specialist 1 position to an Office Specialist 2 position and reallocates the cost from 50% general fund and 50% federal expenditures fund to 27% general fund and 73% federal expenditures fund to reflect the change of duties and responsibilities within the same program. General fund decreases by $15,982 in FY22 and $16,123 in FY23. Federal expenditures fund increases by $20,805 in FY22 and $20,943 in FY23. Let's now look at the last category of personal service initiatives, which is the elimination of positions in the Maine Military Authority Enterprise Fund. This initiative is the top of page A125. Page A125, Initiative 1 eliminates the positions within the Military Training and Operations Program Maine Military Authority Enterprise Fund except one budget manager position that oversees minor contracts and other related activities. The Maine Military Authority ceased its industrial operations in late 2018. As a result, only the budget manager has been retained to manage and oversee MMA's minor contracts and activities. The initiative eliminates all the positions except for the budget manager position to reflect true cost of operations. Maine Military Authority Enterprise Fund decreases by $49,651,794 in FY22 and $51,732,860 in FY23. Moving on to the last two initiatives, which are the only all other budgetary adjustments for the Military Training and Operations Program. These initiatives are carried over from the FY21 supplemental budget and can be found on page A124. Initiative number 1. Reduce funding for facility maintenance and repairs on buildings and engineering contractual services within the Military Training Operations Program. The general fund will decrease by $10,668 in FY22 and $83 in FY23. This initiative reduces some funding for repairs and maintenance to armories and engineering contracted services. The Maine Army National Guard will adjust their maintenance and repair schedule to absorb these cuts within their annual budget. Initiative number 2 reduces funding in utility services in the general fund within the Military Training and Operations Program to align with the required state match in support of facilities, operations, and maintenance funds funded in Appendix 21 of the Master Cooperative Agreement between the State of Maine and the National Guard Bureau. General fund will decrease by $111,000 in FY22 and $111,000 in FY23. License number DAC A51-383-84 between the State of Maine and the Secretary of the Air Force requires that the site shall be maintained and kept in good order. Funding is provided by the State of Maine through Master Cooperative Agreement, which stipulates an approximate cost share of 75% federal and 25% state. This initiative adjusts the state funding required to meet this match based on projected budgets and available federal funding. Pardon me. We will now leave the Military Bureau and move to the Maine Bureau of Veterans Services. The Veterans Services Program, beginning on page A130, provides support to veterans by serving as the primary public advocate for Maine veterans and assisting them and their dependents in obtaining state and federal veteran benefits, overseeing and operating Maine's 4 veteran memorial cemeteries, conducting marketing, outreach, and recognition services, and creating and maintaining a strategic plan to end veteran homelessness in Maine. The program includes general fund, federal expenditures fund, and other special revenue funds. The Maine Bureau of Veterans Services assists veterans in assessing services from the U.S. Department of Veterans Affairs, including housing, medical, and hospital care, educational aid and compensation, vocational rehabilitation, burials, and nursing homes, as well as several state-specific benefits. There are 7 regional offices and a central office located at Camp Keys open to veterans. The Maine Veterans Memorial Cemetery System consists of 4 cemeteries located on Civic Center Drive in Augusta, Mount Vernon Road, Augusta, Lombard Road in Caribou, and Stanley Road in Springvale. The Veterans Services Program funds personal services and all other, which includes professional services, travel, state state vehicle operation, utility, rent, repairs, insurance, general operations, fuel, technology, clothing, equipment, supplies, highway materials, miscellaneous grants, and STA CAP. The Bureau incurs capital expenditures costs for equipment used for the burials. There is no state match requirement for federal funding. There are 8 initiatives to adjust the baseline that can be found on pages A130 through A132. Page A130, Initiative 1 eliminates 1 GIS coordinator position. Federal expenditures fund will decrease by 109,231 in FY22 and 110,374 in FY23. This position has accomplished major tasking initiatives that were set forth when the position was created 5 years ago. A national gravesite locator is already available for patrons seeking to locate a veteran grave. Eliminating this position will free up federal funds to cover operational expenses associated with the main veteran cemeteries. Initiative number 2 eliminates 1 part-time vacant office associate 2 position. General fund will decrease by 36,247 in FY22 and 37,991 in FY23. This initiative eliminates funding for 1 part-time 100% general fund office associate 2 position. This position has never been filled. The position was created to help track and manage the distribution of funds for the Veterans Homelessness Prevention Program. The Bureau has the capacity to manage the program using existing resources. The initiative is carried over from the FY21 supplemental budget. Initiative number 3 eliminates all other funding for 1 temporary office staff position and reduces 2 temporary groundskeeping staff position hours and dates of service for the Caribou and Augusta office within the same program. The general fund will decrease by 36,625 in FY22 and 45,367 in FY23. This initiative eliminates funding for 1 temporary office staff position in Caribou and reduces 2 temporary groundskeeping staff position hours and dates of service. Office staff in Augusta will absorb additional workload from Caribou to ensure that Maine veterans and their families have the assistance they need. The 2 Augusta groundskeeping temporary positions will be reduced from 32 hours per week to 24 hours per week. The Augusta groundskeeping staff will cover the additional workload experienced during the contract reduction. The initiative is carried over from the FY21 supplemental budget. Page A131 Initiative 1 reduces funding by managing employee training, travel, advertising, marketing, and technology contracts within available resources. General fund will decrease by 73,014 in FY22 and 77,803 in FY23. This initiative reduces funding for employee training, travel, advertising, marketing, and technology contracts to achieve department budget reduction goals. While a reduction in travel may inconvenience veterans in more remote locations and will decrease superintendent oversight at remote veteran cemetery locations, efforts are already being made to make every service available online or by phone. Operational adjustments necessary as a result of COVID-19 safety measures have improved the remote and online capability of the Bureau. The Bureau will continue to leverage these capabilities as we move into the future. Contracted marketing services will be absorbed by the Bureau's communication director. The Bureau will continue to operate using technologies currently utilized within the agency. The initiative is carried over from the FY21 supplemental budget. Initiative number 2 reduces funding by allocating cemetery expenses for vehicle repairs, gas, diesel, electricity, building repairs, equipment repairs, fuel cleaning contracts, and rubbish disposal contracts from 100% general to 100% federal expenditures fund within the same program. General fund decreases by 131,037 in FY22 and 131,037 in FY23. Federal expenditures fund increases by 131,037 in FY22 and 131,037 in FY23. This reallocation of cemetery expenses is allowable under the federal plot allowance provided to the state for cemetery operations. Initiative number 3 reduces all other funding one time in the Veteran Services Program General Fund. The General Fund decreases by 100,000 in FY22 and 100,000 in FY23. This initiative reduces all of the funding one time in the Veteran Services Program General Fund. The funding was approved in Public Law 2019, Chapter 504, Section 3. This one-time reduction in all of the funding can be managed utilizing resources within the Bureau dedicated to veterans assistance. In particular, the Bureau can use the Veterans Temporary Assistance Fund, Title 37B, Section 505, to assist veterans in need of temporary housing. Initiative number 4 provides funding for approved reorganization of 6 office associate 2 positions to 6 office specialist 1 positions within the same program. General fund increases by $31,744 in FY22 and $32,589 in FY23. These positions have been reclassified to provide for the additional duties and responsibilities required of the incumbents. Initiative number 5 provides funding for the approved reorganization of Heavy Equipment Operator 1 to Heavy Equipment Operator 2 within the same program. General fund increases by $11,380 in FY22 and $10,173 in FY23. This position has been reclassified to provide for additional duties and responsibilities required of the incumbent. The baseline budget for the Veterans Temporary Assistance Fund program is found on page A132. This is a general fund all other account within the Maine Bureau of Veteran Services established to provide grants for temporary financial assistance to veterans who are residents of the state of Maine. The program provides funding for temporary assistance to eligible veterans as prescribed by the Maine Revised Statute Title 37B 505 subsection 1B and 1C. There are no new initiatives in this program. This concludes my testimony. My staff and I would be happy to address any questions that you may have.
Major General Farnham, thank you very, very much. That was a lot for you to talk about. Do you want to take a break and get something to eat or drink before you?
No, I didn't even take a breath.
I know.
I didn't even take a breath.
Exactly.
So.
Do you want to drink water before we start?
No, I'm good because Director Richmond or my deputy Scott Young are going to answer all your tough questions. I'm only going to take the easy ones.
Okay. So it looks like Representative Kinney has a question, and I think Representative Millett as well.
Thank you, Madam Chair. My question goes back to Initiative 1 on page A125 about the military training and operation program, all the positions being eliminated. What is the reasoning for that? Why are they all being eliminated with the exception of the budget manager?
Oh, at Maine Military Authority?
The military training and operation program.
Yeah, and you're referring to the positions at the Maine Military Authority, is that?
Oh, it was on page A125. It was the first initiative. Yeah, the Maine Military Authority Enterprise. Okay, yeah.
Yes.
That one.
And those are the positions. They're actually, we ceased operations. That was the bus repair, that was the repair site, originally Humvees, and then eventually we were doing some work for the MBTA Massachusetts buses a couple of years ago, and operations stopped and ceased a couple of years ago. So those employees haven't been there. So those are just positions and the associated funding that was on the books when they were in operation, but we hadn't attained those numbers or those dollar amounts in over 10 years.
Major Farnham, would you say that those employees were there to fulfill contract obligations, and we no longer have that contract? Is that correct?
That's correct. That was an MBTA contract most recently, and like I said, that terminated back in 2018.
Great, thank you. Representative Millett and then Representative Fay.
Thank you, Madam Chair. General, I want to commend you on a very detailed presentation. I think my comments, and if there is a question, would be in the easy category.
Okay.
But I was impressed by your opening comments at the bottom of page 3 in terms of the many changes in the cost sharing that you've been able to come up with as a result of the audit of the master cooperative agreement. In your summary, that actually it saved $312,000 in general fund money in 22 and $318,000 in 23. And that got me thinking. So I went back to look at the governor's overview of the budget, and it compares the biennial budgets for 2021 to those in 2020, 22 and 23. And lo and behold, your department actually reduces the general fund budget for the upcoming biennium by over $700,000. which is quite unusual, a 3.6% decrease. And I found the same thing in the military services program, where you've done a lot of rethinking of positions. And so I guess my comment, and really want to know if you're concerned at all, but that audit of the master cooperative agreement, was that self-initiated or was that imposed by the federal? And how long do you think it would likely hold in terms of the cost sharing agreement?
Those cost sharing agreements, and I'll let my deputy jump in at some point if I don't cover this adequately, or they can get into more details when we do work session. But in general, that audit is kind of an ongoing thing. These positions and the responsibilities and what we're asking people to do is a little bit fluid. So there is some leeway there, and we have a property and fiscal officer that it's responsible to the federal government to make sure that we're spending federal dollars correctly and that we are doing these allocations, and that's kind of where that audit comes in. The simple answer is that we dug deep to try to find a way to save general fund dollars and save state money. Some of them are changes in the way the operation works, and I think are good decisions and will carry on forever. Some of them are probably not sustainable for the long term, and that we will continue to look at. And some of that's more probably on the veteran services side, but it holds the same way on as we become more and more reliant on the federal funds. We are more and more reliant on the federal funds, and when they're not there, then we really don't have any cushion for our ops and maintenance. So that's a kind of a overview of what it is. It is something that we can do and we feel very comfortable with over the biennial. But it's a constantly changing thing as the cooperative agreements change and as people interpret duties differently.
Well, thank you. That helps me a little bit, and it causes me to ask the committee to do due diligence in terms of your word sustainability, General, because in the military training and operations, it's a little bit like curtailment in that you're substituting federal resources for general and not necessarily reducing staff. But overall, I guess I want to convey a concern and hope that the VLA committee will take seriously the issue of future sustainability on the service level. Because I think you've done a great job here, as you did in the supplemental, in terms of efficient use of resources and helping us get to a point of balance. But I really want to make sure the committee grasps the importance of looking at the service implications going forward. So it's just a comment. I was impressed with everything you said, and I hope the committee takes the appropriate time to vet everything from the point of view of long-term service delivery. So thank you very much.
Thanks.
Representative Fay.
Thank you, Madam Chair. And thank you, Major General Farnham, for being here. I have to say, I really, as a new member of this committee, I really appreciate the way that you went through each one of the initiatives and kind of explained them and how they worked in each different program. That was really helpful for me. My question is actually on page A116, and it's about the $400,000 for the closure of the Maine Military Authority and environmental cleanup. And I would like to, and certainly not necessarily now, but I'd like to know a little bit more about that and what the cleanup might look like, and you know what some of the concerns are there from an environmental perspective.
Okay. The short answer to that is when we closed, we had a license, from DEP for the hazardous waste disposal. We think that we ran a really great operation up there and don't think there are going to be any issues. But we have to do a baseline inspection or evaluation to know if there are going to be any problems going forward. and primarily to protect the state from 20 years from now, somebody coming back and saying, hey, you left this a mess and you never did it. So in order to close out the license, DEP requires us to have this baseline done, and the $400,000 is an estimate. We've been, it's something that waiting for a supplemental and to trying to get it in the budget, it just gets pushed down the road a little bit. We just need to do it so that, again, to protect the state in the long term, that we have a baseline for what it is, and we don't get blamed for somebody else's mess sometime in the future.
I absolutely appreciate that. Thank you.
Any other questions for Major General Farnham? I am not seeing any. So I want to thank you and let you know I think we're done for today and we're going to move on.
Okay, well, thank you.
Thank you for coming. So next we have the Commission on Governmental Ethics and Practices, and we're joined by Mr. Jonathan Wayne. Welcome.
Good afternoon, everybody. I'm Jonathan Wayne, the Executive Director of the State Ethics Commission, and thank you very much for the opportunity to testify. The budget that relates to the Commission is on pages A195 and A196. So the baseline budget proposal allows the Ethics Commission to continue our current operations, and I thought I would just walk through the different programs that we administer within the three different accounts within our budget. And this is all laid out for you on page 3 of my testimony, if you want to refer to it, because it relates very directly to the most important point that I want to leave you with today, which is at the end of my testimony about how our budget is divided up between the three accounts in our budget. So we're a small independent agency within Maine state government. We're not part of the executive branch, we're not part of the legislature, and we're not part of the Secretary of State's office. We've got 6 employees that are permanent, and we are looking to increase our staff by 1 temporarily during next year, which is the single initiative in the whole budget that relates to us, would help us increase our staff by 1 temporarily. So roughly half of our staff activities are spent on duties that should be paid for from the general fund. And the largest one of those staff activities is that we're the campaign finance agency for the state of Maine. So every election year, we monitor and we help out more than 500 candidates who are running for state and local office, state and county office, I should say. And we also monitor about 130 PACs and ballot question committees that are raising and spending money to influence either candidate elections or ballot question elections. And then there are also dozens of party committees that we also help out, and we monitor them as well, both on the state party level and also on the local level. So that's campaign finance. That's the largest piece of what we do. We also receive annual statements from officials of the sources of their personal income, which all of you are familiar with. We receive those from legislators and also from executive branch officials. And then finally, we also have a bit of a role with legislative ethics, which is that we offer advice to legislators and to others about legislative ethics issues, such as conflicts of interest. So if any of you ever are concerned that there's a bill before you that relates to your employment, you're always welcome to look to us for advice. We're happy to give it to you in whatever format we can. And occasionally we do receive complaints regarding legislative ethics, although those are very rare. So those are all of our responsibilities that should be paid for with the general fund. And then there are, as it's shown on page 3 of my testimony, there are 2 other special revenue accounts that make up our budget. Those are the Maine Clean Election Fund and a fund that consists of lobbyist registration fees that we receive. So our second largest duty is to administer the Maine Clean Election Act program, which I think most of you are familiar with in some fashion. It's a voluntary public campaign funding program. And this is the largest part of our budget in terms of our spending because of all the grants that we pay out to the candidates. But it only makes up about 40% of our staff activities. And that's all paid for from the Maine Clean Election Fund, which is a special revenue account. And then the final part of our duties is to administer Maine's lobbyist disclosure program. So I'm not sure if everybody is aware of this in the legislature, but every year lobbyists register with us on behalf of more than 300 clients. I mean, total between all, and some of them have multiple clients, of course. And they pay a $200 registration fee. And then they file very detailed monthly reports of their activity, how much they're compensated, what are the specific bills that they are working on. And all of that information goes into a database and is uploaded to a public access website for the public and for you as policymakers to have access to, so that you know who is influencing Maine state government. And one of our big projects in the next couple of years is we think we could be doing a much more effective job in creating a user-friendly system for the lobbyists to file the reports, and then also a way for the public and for you to access that information. So that's one of our big projects. Those lobbyist disclosure duties are paid from that special fund that just is relatively small. It just consists of the $200 fees that we get from the lobbyists. So that's the overview of our staff responsibilities. The one initiative in the budget that I referred to earlier is an authorization by you, if you approve of it, for us to hire a project position for the 2022 calendar year. So it would start January 1 of next year and go through December 31st. And this would be a project position. It would be our third candidate registrar who would help out candidates and also monitor them. So some of you have dealt with Emma Burke and Aaron Gordon, who are two absolutely excellent candidate registrars. This would allow us to hire a third candidate registrar, and it would be paid for from the Maine Clean Election Fund. So we're not looking for general fund money to pay for this third candidate registrar. We're just looking for your permission to hire that person. So finally, in my testimony, what I wanted to do was to draw your attention to a long-term issue in our budget that is not addressed in the biennial budget bill. There's nothing before you in the short term that relates to this. It's just something that I would appreciate it if both committees were aware of. And that has to do with the size of our general fund appropriation, which is $180,000. Because of that amount, our office has been charging personnel costs and also some administrative costs to the Maine Clean Election Fund when we believe a better allocation would be from the general fund. We've done this out of necessity in order to keep our services to you and to the other candidates and the elected officials that we serve relatively high. But we think in effect that we're overcharging the Maine Clean Election Fund for personnel and administrative costs that should be paid for from the general fund. And this limits our operations and hurts our effectiveness in two ways. Number one, because we're leaning too much on the Maine Clean Election Fund every year for personnel and administrative costs, that ends up having the effect of drawing down the amount of money that ultimately we have available to pay to candidates in this program that has been approved by the voters twice. So we don't think it's really the right way to go in the long run. And then the other limitation on us is that if you look at page 195, the all other part of our general fund budget is only $8,897. And that $8,800 is what we have in the general fund to pay to OIT for our communications services, or to pay to the General Government Service Center at DAFS for their staff time, or our landlord for our private rent, and also to our IT company to improve our e-filing system. So we quickly use up that $8,800 very quickly, and it ends up meaning that we really don't have any general fund money to spend on roughly the half of our activities that need to be paid for from the general fund. And in particular, when we see opportunities to improve our e-filing system to make it easier for you and for everyone else to use, we really don't have general fund money to pay for those improvements. So there's nothing before you to rectify this situation right now, and that's due to COVID. We did make a proposal in 2019 to the executive branch, and it actually came before the legislature in January or February of 2020. But because of COVID, it really could not be considered seriously. So We hope that this will come back to you with a fix in the next couple of years at some point when it's appropriate, but just because of the pandemic, we did not feel it was right to put this in as a proposal in the biennial budget bill at the time of our deadline. So that's why there's nothing before you regarding this. But I did want to outline the long-term problem because we do hope for a solution someday. So that's my final point. That concludes my testimony, and I'm happy to answer any questions.
Thank you very much, Mr. Wayne. It looks like Representative Tuttle has a question.
Yeah, John, good job. How much money are we talking about for the increase from the general fund to do what you want to do? I know you said there was a bill last session that unfortunately didn't go forward, but I'd be interested what that amount is, and maybe, you know, work with our committee on addressing this issue. So how much money are we talking about?
Sure, absolutely. Well, when it came before you in early 2020, the amount per year that we were looking for would be an increase of $240,000 in the general fund. Our preference would be to work with the executive branch on this. You know, we really do not want to in any way hurt the ability of the executive branch to balance the very important priorities that it is facing right now. So we were waiting to see how that develops, just to be clear about what our strategy was to fix this long term.
But speaking as one member of the committee, I'd like to be updated as to your work with the executive on getting this done, because having been involved, I think I was the chair of the committee when we first got involved with the clean elections aspect of the law, and we've really done an awful lot of good things with limited resources. So if he could keep me and other members of the committee up on what's going on, because I think it's something that really needs to be addressed in the near future, John. But thank you for your input.
Thank you very much, Representative Tuttle. I will, of course, be happy to do that.
Any other questions for Mr. Wayne and the Ethics Commission? Not seeing any.
Thank you very much.
Thanks for joining us today.
Thank you.
Next, we are going to hear from the Department of Secretary of State about elections and commissions.
Good afternoon, Senator Breen.
Good afternoon, Secretary Bellows. Welcome.
Thank you. Representative Peirce, Senator Lucchini, Representative Chiazzo, members of the committee. My name is Secretary Shenna Bellows. I am the Secretary of State, here to present testimony in support of those items presented in the 2022-2023 biennial budget for the Department of Secretary of State. Department information begins on page A472 of the budget document. Elections and Commissions 0693. There is one Federal Expenditures Fund initiative. The initiative provides funding for the 2018 and 2020 Help America Vote Act, or HAVA, Election Security Grant Award for activities consistent with the laws described in Section 101 of HAVA. And the all other request is $3 million in fiscal year 2021-2022 and $3 million in fiscal year 2022-2023. In 2020, the U.S. Congress appropriated additional federal grant funds to make payments to states for activities to improve the administration of elections for federal office, including to enhance election technology and make election security improvements to the systems, equipment, and processes used in the federal elections. Maine's share of the 2020 funding is $3,512,764, with a 20% match share of $702,553. The state match portion will come from general fund expenditures on annual leasing of tabulating equipment and central voter registration, or CVR, maintenance. This funding is combined with the 2018 HAVA Election Security Grant, and the term changed to until funds are expended. There is language item in Part MMM on page 48 authorizing the state comptroller to carry forward any unexpended balance in the all other line category at the end of fiscal year 2020, 2021 to fiscal year 2021, 2022 and fiscal year 2022, 2023 in the Department of Secretary of State Elections and Commissions program to be used as match for the 2018 federal Help America Vote Act election security grant of $3,130,979. That match is 5% or $156,549 in the Elections and Commissions carrying account, which was appropriated in fiscal year 2019-2020. This concludes my testimony. I am joined by our wonderful Deputy Secretary of State, Julie Flynn, who heads the Division of Elections, Corporations, and Commissions, or rather Corporations, Elections, and Commissions, and our Director, David LaChance, who is our Director of Budget and Finance. I'd be happy to answer any questions now at this time or in the work session.
Thank you, Secretary Bellows. Any questions for Secretary of State's? I see Representative McCray.
Thank you, Madam Chair, and thank you, Secretary Bellows. I know we're going to hear from the other people, but I just wanted to check in with you because I'm not seeing any staff increases and wonder if that's, if you feel you have sufficient staff at this time. Thank you.
Thank you very much, Representative McCray. You may recall that when I briefed the Veterans and Legal Affairs Committee at the beginning of the session, I talked through our overall budget. And I shared with you that in 2020, we had a team of 7 led by Deputy Secretary Julie Flynn, who conducted the work of all of the elections, and that they together engaged in 73 weeks of overtime. Again, that's 73 weeks of overtime. I will say I was just sworn in January. Over the past month, our staff, which is now 8 people led by Julie because we have filled a vacancy, but our staff in the last month, again, has been working extraordinary overtime due to the requirements of the job, certification of petitions specifically. So for example, President's Day weekend, they were all there. And indeed, Julie and I were talking on Monday. She said this was the first weekend that she hadn't worked since I was sworn in. So the answer is we are mindful that we are in a pandemic. We are mindful that there are limitations on the budget, but I would like to share with you that I am concerned that the elections division is understaffed.
Looks like Representative Chiazzo has a question.
Thank you, Madam Chair. This might be for Mr. LaChance. I'm wondering if, based on the amount of overtime that we're paying out, if there's an analysis that's been done in terms of the cost of new positions versus the amount of overtime that's being expended.
Yes, Representative Chiazzo, we have done an analysis as you have asked for. We can pull that together. And I think Deputy Secretary Julie Flynn is also on the line.
Mr. LaChance, can you make sure that Appropriations Committee members get that as well?
Yes, we can.
Thank you.
Julie, did you have a comment as well?
Yes, can you hear me? I'm sorry, I suddenly lost my video monitor, so I had to go to another place.
Can hear you and see you.
Okay, and I'm sorry, can you repeat the question? I'm not sure what.
Representative Chiazzo, go ahead and repeat the question.
Thank you, Madam Chair. I was wondering if we could see an analysis of the cost of overtime versus the cost of new positions to see what that funding, the differences in the funding and what that might look like, please.
I think the query that we get from Advantage is, it has to be massaged a little bit. What we included in that 73 weeks includes almost 30 weeks of overtime by myself, Melissa Packard, and Heidi Peckham, who are all what we call overtime exempt. So we don't get paid for that. That's all, you know, time that we're working that we're not getting compensated for because we're salaried employees. So, and the rest is a combination of comp time toward the end of a budget year, if we still have money left in our salary plan because of vacancies, we're able to offer paid overtime. So I think we can get that for the work session and give you that versus the cost. But I would say that I can't think of the word that I want to use, but the real cost is going to be for staff burnout because, you know, we took a week off between Christmas and New Year's, each of the three of our managers. And that's all we could take last year. So, and the other staff that maxed out on comp time, they're carrying the 40 weeks. So that's a different cost that isn't really monetary, but it will be if we lose staff and then have to go through a hiring process and bring on new people and get them up to speed.
Looks like the Secretary of State Bellows, would you like to follow up with that?
I would just like to applaud Deputy Secretary Julie Flynn. The fact that we have someone of her level of experience and commitment. She herself worked over 9 weeks of overtime in 2020. And we are fortunate that we have such a dedicated and committed team of people who are willing to do that. It is not sustainable in the long term for the state of Maine.
Representative Chiazzo, are you all set?
Yeah, I had a follow-up if you don't mind, Madam Chair.
Okay, go ahead.
Thank you. Yeah, I think, you know, the real concern also to kind of echo what Secretary Bellows and Ms. Flynn have said is, you know, we can look at it from a full-time equivalency perspective as well. Just because somebody doesn't necessarily is compensated for overtime, it doesn't mean that that work shouldn't be allocated for appropriately in the budget. So I would be very interested if we can't do a fiscal calculation in terms of the actual dollars spent. I would certainly want to look at hours spent and the full-time equivalents of 73 hours or 73 weeks of overtime. I'm sure we'll find that ultimately the costs are going to be for more positions as well. But again, that would just be my my request. Thank you.
Any other questions for the Secretary of State's office? Not seeing any. So thank you all for joining us.
Thank you.
We do not have any members of the public today who are going to be offering testimony. So I believe that concludes our public hearing for today, but I do want to check with our analyst and make sure I'm correct about that. Maureen, can you join us momentarily? Here she comes.
Yes. I see nobody in your attendees box either, or have anybody on a list to testify for the public. So I think you are all set for the afternoon.
Okay. Looks like Representative Tuttle has a question.
Just a brief comment, Madam Chair. I attended the opening of the Sanford COVID-19 clinic this morning, and we're planning on doing over 224 today, something that I feel pretty good about. I know that the City Council and the Mayor, former State Representative Mastracchio, and Dr. Shaw was there, and I commented to him how lucky we are that he's in service to the state. So I think hopefully we've overcome the beginning. We're hoping that in the near future we'll be doing 1,000 a day, Madam Chair. So I was very pleased about that.
That's great news. Thank you for letting us know. Any other comments, closing comments from our friends on VLA before we say thank you and let you go? All right, we look forward to your report back. And thank you so much for joining us this afternoon. And appropriations folks will just stay on for a couple minutes just to wrap up and preview tomorrow. To the best of my knowledge, tomorrow is Wednesday, March 3rd. Woo, 3 weeks of public hearings on Zoom. All right, we are getting to the end. So tomorrow we have we're going to be starting at 10 a.m. again, and we have some more presentations from the DAFS commissioner regarding executive branch departments, and we'll hear more about our debt service from the treasurer's office. And we then will also reconvene at 1 o'clock to hear from some more. We'll be joined by state and local government at 1 o'clock to go over some more items related to our state and local government functions. So, Maureen?
I just wanted to reiterate, I think you properly did not mention legislature because we don't get a presentation about that portion of the budget. You generally get a letter from the Legislative Council, either agreeing with the budget or asking for something different. So I just wanted to make sure that nobody was expecting anything regarding that to be presented. If there's public that want to testify, then of course that would be the slot they would do so in. But just wanted to make that clear for new members.
Thank you for that reminder, Maureen. Representative Corey, you have a question or a comment?
Yeah, Senator Breen, you've turned blue on us. Are you feeling okay?
Thank you. I
Did
think
we send
it's,
rescue over there? Is your
I'm actually breathing quite normally. It has something to do with the reflection from the snow, I think, coming in my window. I don't know.
It looks a little like Willy Wonka in the Chocolate Factory, I gotta say.
Interesting.
It's very Smurfy.
Oh, okay. Well, thank you for your concern, Representative Corey. I really appreciate that.
You're welcome.
Any other fake expressions of concern? Thank you all for being here today. And thank you, Maureen, and thank you, Mary Ann, who's back with us, already acting like an old pro. So Mandy can go back to the rest of her job. Thank you very much. And I think that's it for this afternoon, and we'll see you tomorrow morning at 10 a.m.